Hello, welcome to Tara Talkies. This is Tara Sahota. How is everybody doing? So thank you very much for checking out my videos and sending your responses and your requests. And today's episode is actually dedicated to Celban writing task 1. So we are just going to focus. I'm just going to give you some tips. What is the requirement of touchstone in your Celban exam? What they are expecting you to write in Celban tests, and how you can score good marks. I've already shared lots of general tips in my previous video. There are 2 writing videos available on my channel. You can just check them out. I'm going to share the links of those 2 videos and in the comment section of this video as well. So you can definitely go and, have a look at them first, and then, check this video as well. So this is definitely going to help you out. So we are going to focus on writing task 1 out of the 2 writing tasks that the Celban writing portion will have. All right, so let me just share my screen with you, and I'll be able to actually show how and this writing task 1 is going to appear, what you are looking at it, and how you can make it simple and easy. All right. Okay, so let's go over here. Okay, so as you can see my screen, this is how exactly. So this is the sample, available with Touchstone, the material that they have released. So this is an example how an assessment will, like an incident report that you will be writing after performing all your assessment. If patient had a fall or something has happened, so they are going to give you all the information you can see here. So this is an incident report. This is the name of the nursing home or clinic or hospital will be given here, date, incident date, time, name of the patient, in time of incident, location, type of incident, witness, nature of injury, contributing factors, vital signs. So all these things are actually going to be given to you. So technically, you have all the information in front of you. So I would say writing task 1 is a pretty easy task. Okay, just for a review, let me tell you one more time. So your total writing task is going to be of 40 minutes. So 20 minutes each task you can divide, but there is no requirement that you have to give 20 minutes to each task. But definitely you should divide your time wisely so that you have enough time to spend on both of them. You should have enough time to proofread both the writings so that you can actually check out, and if there are some mistakes which you would be able to find out before you actually submit your exam. So make sure that you have enough time to use your creativity, enough time to proofread it before you're actually submitting it. So 40 minutes in total, 20 minutes you can give to each writing. I would say give 15 minutes for writing and 5 minutes keep for each writing, so that you can go over it, and if you want to add anything or you want to correct anything, you can do that. All right, so writing task 1, as you know, that's like an incident report. So as all nurses, they note down the incident reports if something has happened in your clinical setting. So you write down, you record that, and you report it in the form of a written report. So that's what the incident report is. So it's basically stating all the facts, whatever has happened. So you are using all the tenses over here. You're using the past tense, present, and what is happening in the future, because client has already, fallen, or the thing has, or incident has already happened. So that happened in the past. What you are doing right now is your present tense, and what are you going to do with the follow-up? That is your future tense. So all 3 of them are going to be used there. So make sure that you're using tenses correctly when you're stating, or if you're stating any actual statements by the patient, they should be as it is in the present tense. So you can just put them in the quote. So this is a scenario of Miss Elsa Williams, and the time is 8:45 a.m. Location is hallway. So type of incident is fall, and there was a witness involved as well. The nature of injury, what has happened, is mentioned there, and what are the contributing factors is mentioned there as well. So everything is there. So you just have to use these words and put it in the paragraph. So you are required to write 3 paragraphs. So the first paragraph is basically your introduction. Second paragraph is your body or the development of the actual content, and the last paragraph is like your in case of incident report, what follow-ups or what things that you're going to do in order to take care of what has happened. So that's an incident report. And writing task 2, it will also at least minimum you're writing 3 paragraphs: introduction, your body or the development, or conclusion. Okay, so writing task 2 we'll talk about it later, but this time we are just focused on writing task 1. So you're seeing this example, and let's check this out. So this is what they want you to do. As simple as it is, use complete sentences and paragraph format. Tell what happened and who was involved. Explain when, where, and how it happened. Include possible causes of the incident. Explain everything that was done and by whom. Link events to create a coherent narrative. Your response should be between 250 and 300 words. So you can practice writing by timing yourself. And of course, if you're writing it, because it's going to be a typing exam, so you can, pull up your Word document, you can type it, and Word actually tells you how many words you're typing. So you can literally see it on the task below when you're typing in the Word document. You can actually see how many words you're typing. So it's pretty easy because you're typing, you literally don't have to count the words. And make sure that you're practicing typing, as I advised you before too. So don't write it on a piece of paper and practice, but type it and practice it, and make sure that your words do not exceed more than 300. Another thing is that they are not much bothered by the length of your writing task 1 or 2, but they are much concerned for the quality of writing. Like if the tenses are correct, it's grammatically correct, there is an organization, there is a flow, it's fluent, it's understandable, that reader is able to, find answers to the questions, they're able to see, what you're trying to tell. So if it is, kind of all over the places, you're just, added sentences, but they don't make any sense. And even if you have written a longer paragraphs, it's not going to help you to score marks. So it should have quality. Your writing should be, organized. Your writing should be grammatically correct. That's very, very, very important. So make sure that you focus on that. Do not only focus on the words and the length of the paragraph. Okay, so based on this example, I'm just gonna give you this example answer for this. And of course, you can make your own as well. You can change it in a different ways. But the only important thing is that when you're writing an incident report, make sure that you're mentioning the time. So when, why, who, how things have happened. So you should have answers to these questions: when that thing happened, how that thing happened, who saw it, with whom it happened, how it happened, what is the current situation of the patient, what is done to the patient after that, who was involved in that, who was informed about it. So all these questions have to be answered in your incident report. So if you're getting all those answers and they are in a flow, pretty good. And also based on what points they have already given you in the incident report, you can add on some, story to it. In your, nursing education years, you might have gone through, your practical in your clinical area. So you have seen patients, or maybe if you have worked in a hospital setting already, so what are the, scenarios. So kind of, get be creative with all the background information that you have about the clinical setting. So kind of create your own story, build it up, and make it a nice presentation. So for this, we can just say it like on February 5th, 2021, 8 a.m. Patient Miss Elsa, resident of Mount Surrey. So the name of the hospital is there. Found on the floor on the highway is mentioned. Fall was witnessed by whom is mentioned over here. On the scene, at this time, in what condition the patient was found, and patient was alert because the patient was answering. Then what you did, you performed head-to-toe assessment, all right? You noticed that the patient was not able to bear, weight on the right knee. So you check that, and this thing is added additional. There was no other injury or active bleeding reported. So you can add few things which make sense. Then Miss Elsa looks paranoid because it's mentioned in the sheet that she was paranoid. So how she's paranoid, you can mention some symptoms that was noticed. So she was blaming other patients for her fall, or like she was giving some other weird statements. Then vital signs, the vital signs are already mentioned in the report, so you can just put them. Your pain assessment was done, and what explanation she gave to you, and what was the explanation of the witness. Then after all these things, whatever was done, of course, by this time, or after your initial assessment, or somebody else might have called the physician. So physician was informed at what time, he ordered the x-ray, prescribed extrafrontalinol. Then of course you will inform your nurse manager, and then what treatment was done for the patient. So patient's leg was elevated, ice pack was applied as per the instructions by physician, and then was transferred to her room. And Miss Elsa Williams' next kin was informed, so that's her family was informed, and patient's transportation arrangement was made for the X-ray, because we are assuming that this is a nursing home, so patient needs to be transported, to the city hospital in order to get the X-ray done. So definitely we can mention that, though it's not literally mentioned that you've arranged the transportation, but that's how the story goes, right? That's what your responsibility is. So you can definitely add it. An incident was recorded in the nursing report. You can add more things to it as well, make it more creative, but make sure that is grammatically correct. It's in a flow and it makes sense. And it's not all over the places. Go sequence wise how things are happening. Don't just, randomly pick things and add them. All right, so this is how a report is going to look like. So you can just kind of get an idea from here and add some more things, make it more interesting. And I think if you have practiced, a few times, the report is going to be same. Maybe the given facts might change a bit, but there's nothing else that's going to change here. So I think it's the best way that you must practice it, practice your typing. And if you have any other questions, definitely you can leave that in my inbox. I'll be able to definitely answer you back. So thank you very much for watching, and all the best with your preparation. Take care of yourself.